The government's announced more funding for scans and tests critical for determining if a patient has cancer amid ballooning wait times. In the next year, Health Minister Simeon Brown says an extra 7,100 patients will get colonoscopies. There'll be more cardiac tests, a boost to cervical examinations, and more than 60,000 radiology procedures will be carried out. And he'll be leaning on private operators to get it done. Health Minister Simeon Brown is with us now. Thanks very much for being with us, Minister. So radiologists have told me some are waiting for scans for so long, they're developing terminal cancer while they wait. Are you aware of this?
Look, I know that the advice from Health New Zealand is that more than 40,000 New Zealanders are waiting too long to receive the scans and tests that they need. Clearly, if people are waiting too long, there are risks to whether it's cancer or other conditions that may develop during that time. And so that is why Health New Zealand has put together the diagnostics investment plan to make sure that we are increasing the number of diagnostic procedures being done to get on top of those wait lists, reduce those wait times so that people can get the answers that they need and start the treatments they need sooner. So we acknowledge
Minister, just interrupt you there. So what is an acceptable wait time in your view? I mean, is it weeks or months or 12 months?
So it depends on the particular type of scan or test. So if you're recommended for an urgent colonoscopy, the expectation is that people receive those within 14 days. If it's a routine colonoscopy, if you're on a surveillance colonoscopy, then there's I think it's several weeks.
Okay, so it's an expectation. It's not a guarantee, though, is it, that you would get it within those timeframes?
No, those are the targets that Health New Zealand have set. They have not been meeting those targets. This additional funding is designed to support delivery against those targets so that we can increase access. And the critical one is those patients referred for urgent colonoscopies. Those must be done within 14 days. And by outsourcing and using private providers to maximise capacity, which, as you mentioned in your introduction, is a critical component of this, we're able to get more done so that patients can get those answers sooner. And if cancer is identified, they can then get on to the treatment that they need as quickly as they can.
Okay, so what have you said to Health New Zealand in terms of when, how long it's going to be before these wait times come down? Like by Christmas, are we going to see a significant difference, or is it going to be halfway through next year?
Well, the reduction in the wait times needs to start immediately. Clearly, it will take time due to the significant size of these wait lists. We're dealing with wait lists, whether it's here with diagnostics, wait lists for specialist appointments, wait lists for elective surgeries. And my message very clearly to Health New Zealand is we need to maximise capacity across both the public system and the private system to reduce those wait lists. We have started to see some really good progress on elective surgeries this year. We've had a significant reduction in the number of people, I think about 22% reduction in the number of people waiting more than 4 months for an elective surgery, which is a significant reduction in that wait list. But clearly, look, there is a lot of work to do. And my expectation of Health New Zealand is that they get on and deliver it, maximising what can be done within the public system, whilst also using private providers so that patients are put first and we get as much done as possible.
Okay, I just want to return to the colonoscopies. I mean, if you're increasing the number of colonoscopies, that's going to put additional demand on pathologists, and the experts these are the experts needed to report the results of the samples. Did you speak to pathologists before making this announcement?
Well, look, Health New Zealand has developed this plan.
Did Health New Zealand speak to them before this plan was announced?
Well, it's worked through. It's been led by clinicians, and it's been worked through its clinical networks to ensure that there is a clear plan put together which covers not just increased activity, investment in our workforce, also looking at digital and technological solutions that are required as well. So the plan is not just about increasing capacity, but a whole range of measures needed to make sure that the system is able to work better for patients, right from the process of diagnostics through to making sure that we can deliver those treatments. And of course, Alongside, when it comes to cancer, this government's invested a record $600 million additional to Pharmac's budget, which has so far funded an additional 33 cancer medicines. That makes a huge difference in patients' lives.
And I'm aware of the budget allocation, and that's fantastic. But the Royal College of Pathologists have told me that we hope to hear from the Minister the details of this policy announcement so we can understand how it'll address long-standing pathology and training shortages. So do you have those details, Minister?
Well, there's a range of initiatives as part of this plan, including increased activity, investment in the workforce, increased investment into training for radiology and also into echosonographers. In terms of the issue around making sure that there is investment in pathology, there is work underway within Health New Zealand to do that as well. But as I said, the investment here is not just about increased access to diagnostics.
Are you going to make an announcement?
It's also about making sure that we can continue to get patients that continuum of treatment and care that they need, so that they can get the care that get seen quicker and get treatment quicker.
Understood. So are you anticipating an announcement that you'll be making an announcement about investment in pathology soon?
Well, I think there's certainly work underway within Health New Zealand to address those concerns. My expectation is that Health New Zealand continues to meet with those stakeholders to make sure that the investment, the record investment this government has made into health is continuing to focus on frontline service delivery so that patients can be seen sooner and get the treatment they need quicker.
Okay, Health Minister Simeon Brown, thanks very much for joining us on Herald Now this morning. Appreciate your time. Well, we're joined now by